Hello, my name is Holly, and I'm an intern with Leadership Initiatives. Today, I will be helping to diagnose and treat you.
Wai sunanta Holly kuma tana so ta taimaka wajen a gane me yake damunta. So rakin kuɗin tambayoyi. So you can go ahead, Holly.
Okay, do I have permission to ask questions to help diagnose?
Yes, please.
Okay, thank you. So first, what is the patient's name?
Wai ne sunanta?
Okay, and how
Uh,
old is the patient?
Okay, the patient is 4 years old. She's Aisha Suleiman by name.
Okay, and is she an only child or does she have any siblings?
Tana da sauran 'yan uwa ne ko ita kaɗai ce? Okay, she actually has four other siblings. She's the last of them, and she resides with both of her parents.
Okay, and what is it like where she lives? Are they near a water source? Is the house, how many people live in the house?
Okay, wai a yanda kuke zama mutum nawa ne kuma akwai ruwa ne a gidan? Okay, she actually stays with two of her parents, her mom and her dad, and the four siblings that I mentioned earlier. They live in a self-owned two-bedroom apartment, and they also have a well in the house.
Okay. Okay, thank you. So what is the primary complaint of the patient today?
Okay, wai mene yake damunta? Okay, she's been having this fever for the past 2 days with associated abdominal pain, and when she's urinating, she also experiences some pain.
Sorry, may you please repeat that last part?
Okay, the last part is when she's passing urine, she usually has some pain.
Thank you. Okay, so what is the nature of the fever? Is it consistent or would you say it's intermittent?
Wai ya wannan zazzabin yake? Yana nan ko da yaushe ne ko yana zuwa ya je ya dawo? It's actually intermittent, but it's worse
Intermittent.
in the evening hours. Yes.
Okay. Has the where the patient lives, is she near a still body of water?
Okay, wai a inda kuke zama akwai wani irin ɗan ruwa haka da baya gudu ne ko kwata ko wani abu ko. Okay, they actually have a well at home. Apart from that, they don't have any other stagnant body of water.
Okay, thank you. And then along with the fever and abdominal pain, is the patient experiencing any headaches or chills?
Okay, bayan wannan zazzaɓin da ciwon cikin akwai kaman karkarwan sanyi ne? Okay, she does have some chills sometimes, um, but she does not have any other symptom like vomiting or diarrhea, constipation, or respiratory tract symptoms.
Did you say no constipation or diarrhea?
Yeah, no constipation or diarrhea.
Okay, thank you. So, um, is the patient feeling tired at all, like abnormally tired?
Me tana nuna kaman ta gaji ne a koda yaushe. Yeah, she actually has been having this low energy these past few days.
Okay. Would you mind if I see the patient's palms?
Okay, wai tana so ta ga tafin hannun yarinyar. Ga mata kusa.
All right.
Right.
Thank you.
Okay. Yeah.
Thank you for that.
Yeah.
And does the patient have any respiratory problems, like trouble breathing?
Wai akwai wuyan numfashi ne? No, she doesn't have any trouble with breathing.
Okay. So, based on the intermittent fever and the abdominal pain, I would like to order a rapid diagnostic test for malaria.
Okay, great. We actually did a rapid diagnostic test for a blood film for malaria, and it showed two classes of malaria parasites.
Okay, thank you. And then also, I would like to order a hemoglobin count because of the patient's palms and tiredness.
Okay, so the hemoglobin level is 9 grams per deciliter.
Okay, so then I'm going to say that the patient also has anemia. For
Yeah,
Okay, for the anemia treatment, I would say taking oral iron.
great.
And for the malaria, I would recommend taking ACT.
Okay. Wai saboda tana tunanin kamar tana da malaria, za ta ba ta magani ACT ko? Sannan kuma za ta so ta sha iron tablet saboda jinin ta ɗan yi ƙasa kaɗan. Ko? Yeah. So to actually understand your treatment plan, is there any other thing you'd like to tell your patient?
Um, yes, I would also say to take antipyretics for the fever.
Okay. So
And
wait, yes, go ahead.
and also make sure to stay hydrated, mostly because of the abdominal pain.
Okay. Wai tana so ta ya zama ta sha ɗan maganin zazzaɓi ko sannan kuma ta sha ruwa sosai ko? Yeah. So is there any other thing you like to tell your patient, Holly?
I would also like to talk about prevention.
Yes,
So,
please go ahead.
for the anemia, would you mind telling me what their diet is?
Okay, wai kamar yanayin abincinku yawanci wani iri wai ya yanayin abincinku yake? Hmm? Ya yanayin abincinku? Ah, me mafi akasari kuke ci? Fatin shinkafa? Abubuwan Okay. Okay. Their diet is mainly carbohydrate based. They usually take rice and maize gruel, and sometimes they add some beans and some soup to the diet.
Okay, I would say along with that to add some spinach and some leafy greens for more iron. And a good way
Okay.
to do this, since the patient eats rice, is jollof rice, which you can add extra spinach to. Yes.
Yeah, Nigerian jollof rice. So wait, so tana so idan kuna cin abinci, ku ɗan sa ɗan ganye a ciki, kuma saboda ya ƙara mata jini. Kin gane? Yawwa. Sannan kuma za a ba ku iron tablets sai ku sha saboda ya ƙara mata jini. Yeah, that's perfect, Harley. So, is there any other thing else you'd like to say to your patient, or that will be it?
Yes, for prevention of malaria in the future, does the patient sleep under bed nets or under mosquito nets while they sleep?
Yes, they do.
Okay, I would recommend to continue doing that. And also with the well in the house, um, avoid going too close to that because there might be mosquitoes around there because that's mostly where they breed. And
Okay,
if the patient's house isn't normally sprayed for mosquitoes, I would recommend doing that too.
great. But tana so tana zuwa kusa da wannan rijiyar taku kuma take sa dogayen kaya da zai rufe mata hannaye ko? Sannan kuma duk wani abin da zai kare ki daga cizon sauro, maganin sauro duka ana amfani da shi. Yeah, so they're very grateful for all the things that you said to them, Holly. And they're also grateful that you're doing this for them and helping them diagnose their child and treating the child. So if you're all done, I think you can wave your patient goodbye and then we'll have a nice day. Okay?
All right. Thank you so much. I hope you
So
feel
tana muku
better.
bye bye. Right. Yeah.